This is Smarty. She's a medical professional and does her job by the book. To prepare her for work at the Canberra Hospital, she has read all of the paperwork, done all of her online training modules, and is ready to get stuck into caring about people. This is Silly. She likes people and is friendly, but she doesn't follow directions all too well. This is how we are supposed to complete the online training modules. Read the instructions and attempt the quizzes at the end. This is how we learn about patient confidentiality. Mr. Smith has a sexually transmitted disease. I hear it's contagious. We're not supposed to talk about patients in public. It's not confidential. Get bent, Smarty. Those rules are for squares. So, my patient's been feeling a bit crook and he's got a cough, but he'll be alright. I don't think there'll be a problem. Oh, now, I don't mean to be rude, Silly, but I think there are some things missing from your handover. Watch how Smarty does it best. First, let me introduce myself. My name is Smarty, and I am a medical officer at Canberra Hospital. Our situation involves Mr. Bloggs, who came here 3 days ago with a productive cough and fever. His background history is unremarkable. On examination, he was febrile, tachypneic, and on auscultation, I could hear coarse crackles in the right lung base. A chest x-ray has shown consolidation in the right lower lobe. My assessment is that he has pneumonia. He is currently responding well to treatment and is improving. I recommend that the afternoon team continue his current management plan and monitor for any changes. Oh, that took way too long. How am I supposed to check my emails if I spend so much time talking to patients? Oh, I think this is garden variety community-acquired pneumonia. Let's just give antibiotics. Some IV Benpen should do just the trick. That's a good idea, Silly, but we should first check the patient's medical chart for allergies. Well, it looks like Mr. Bloggs is actually allergic to penicillins. Hey, Silly, can you please stop while I look up an alternative antibiotic in the therapeutic guidelines? Stop! What are you doing? Mr. Bloggs is allergic to penicillins. He's going to have an anaphylactic reaction. Wait, what? Well, how was I meant to know? All right, let's do a team timeout. Timeout, schmimeout. I know what to do. Success! A perfect removal of this patient's left arm. Silly, you need to apologize to the patient and admit your mistake. That's what open disclosure is. Oh, I know it can be hard to admit your mistake, Silly, but Smarty will show you how. Mr. Berry, my name is Dr. Smarty, and this is Dr. Silly. We're surgeons here at the hospital. We're here to apologize for what has happened to you earlier today. We made a mistake as a team and unfortunately decided to operate on the wrong arm. We're sorry this happened and are investigating this incident and will keep you fully updated on the progress. If you would like to make a complaint, we will explain how you can do this. Do you have any questions? Well, we hope you learned something about professionalism and leadership in the workplace with this short instructional video. If you get stuck, just remember the 5 rules of professionalism. Rule number 1, always maintain patient confidentiality. Rule number 2, always give a good ISBAR handover. Rule number 3, use graded assertiveness when you see a mistake is about to be made. Rule number 4, always observe team timeouts. Rule number 5, always use open disclosure when you make a mistake. Now, you're ready to step into the wards. You go get them, doctors.